Hello, Dr. Naif Sinada.
How you
So
doing, my
great to
friend?
have you here on Thrive Live 2021. How are you today?
I am happy to be here. What an event, huh?
Oh, it's amazing. It's an amazing event that Henry Schein puts on, and I'm really excited to talk to a colleague about prosthodontics, which is truly my love, and I'm so impressed, what you've done and your team that you work with and what you've been able to accomplish at really a very young age. So amazing, amazing. Let me start off by asking you, why prosthodontics? You went to dental school. How did you decide this was your specialty?
I always say I didn't decide. It decided for me. I'm the youngest of a family of dentists. So my siblings are both dentists. My brother's a prosthodontist and my sister's a pediatric dentist. And my wife's a pediatric dentist and my brother's wife is a pediatric dentist. So we're in a group of dentists. For the longest time, being the youngest one, I was just in resistance. I was like, I can't do this. I don't want to do this. And then as I started my GPR, I just realized that the joy that comes to me from prosthodontic work, I wasn't thinking about the work. It was just happening and there was a flow. And that was just like, you know what, this is what I need to be doing with my life. And so the rest is history.
That's amazing. That's amazing. We have lots of choices that we have as an individual and as people and with our families. And it sounds like your pathway was kind of paved a little early for you. So that's pretty amazing. So Naif, let's talk about how you practice. Dentistry could be and used to be very much a solo sport. And,
Sure.
We grow up going through our journey to get into dentistry with a lot of memorization, a lot of kind of studying by ourselves. But we know that once we come out, it's literally the opposite. The opposite of creativity and collaboration. Tell us a little bit about how you practice, the people you practice with, the disciplines together to do what you do for your patients.
Yeah, that's a great point. There's a lot of things that you said there that really hit home. One of them is that when you're out in the real world, you're alone. The beauty of, I feel like I hit the jackpot in terms of the generation that I graduated in the sense that when I started residency, I started a social media account. And I quickly learned that, I started a social media account really just to kind of to see other people's work, see what's out there, see what they're doing. But what I quickly realized was this was not a platform really for me just to learn or to see what's out there. It was really a growth platform. And what I mean by that is I can see other people's work and collaborate and feel like I'm in the room with other doctors when we're just in a chat room talking about potential treatments, et cetera. And it quickly growed, obviously, since, the times that I started there, and that you really are no longer alone. You don't have to ever feel like you practice alone, whether it's Facebook, Instagram, Twitter, LinkedIn, now TikTok. There's always a platform for other people to grow together. And so the days, like you said, the days of solo practice where you're just kind of struggling 9 to 5 and not really knowing if you're making the right decisions, I want to say those days are gone.
Yeah, I think so too. And that is the exciting thing about getting out and practicing, but also a philosophy and the strategies of practice. And I know that you joined with a number of prosthodontists and implantologists to do what you do, which is truly inspirational, I think, for the young dentists, because, you represent this next generation of specialists that can provide care at an extremely high level, but through collaboration, because we know that's when the magic happens, how we can hit off each other and that we work together. Amazing. Tell me a little bit about your breakthrough technologies. What are the new technologies today that are impacting how you practice and how your team works together?
We like to think, and I really think you're the same way, even though you might not want to admit it, but you're the same way. We live on the bleeding edge, and there's always new stuff coming out. And so I get a lot of people asking me, what scanner should I get? What technology should I invest in? And in reality, if you listen to lectures 5 years ago or so, there's always people focusing on comparing two scanner types and the accuracy in between them and the precision and the trueness and the color. These days, virtually all scanners can get you close. It's a matter of just tipping your foot in the water first. So really, the technology that I'd say has changed us just to focus on one is intraoral scanning, obviously. But, a theme in general is, and we kind of talked about this briefly, is that the workflow or the principles don't really change. So the technology hasn't changed how we practice, or what we practice, I should say. It's changed how we practice. And what I mean by that is it's made us more efficient. What happens when you embed efficiency into prosthodontics in particular is that you eliminate the minutia, and what you allow to shine is the passion of the clinician. And so you're able to let your passion for your work show. Patients obviously always appreciate efficiency, but when you see that your creativity is super bright, you are excited about what you're doing, and you're really being efficient at it, that's really what the human element is, what the digital workflow kind of brings out.
Yes, exactly right. I couldn't agree with you more. And the ability to design smiles and to design restorations from a natural tooth form and from a facial aesthetic standpoint, which we always believed for a few decades. We did diagnostic wax up, but a technician would be with wax, where now we're designing on computers from the natural tooth form and looking at the face, right?
Brilliant.
So it is a bit of a new day.
And just to exactly what you just said there, and let me kind of highlight it in a few cases in particular. So one case in particular, we had a young mother who was edentulated way too early and had an old set of dentures. And when we talk about the human element coming out in this efficiency, it just became one of those conversations. Well, she always came with her daughter, and she would always say, whenever we asked about her chief complaint, she would always say, well, I really like my daughter's smile. And then it dawned on us and said, well, would you like your daughter's smile? Would you like your daughter's teeth? And it's just a matter of scanning her daughter's teeth. So they switcherooed that she got out of the chair, my daughter gets in, we scan daughter's teeth, and guess what? Now she can have her daughter's teeth in her dentures. Obviously, we had to age them a little bit, wear them a little bit, but she now has the smile that she actually wanted, not the smile that we thought she deserved, but the smile that she wanted, which is an amazing concept if you think about it. And that's what I mean by when I say the human element is in our prosthodontics. Nothing's changed. We could have done the same thing with an alginate and then poured it up in stone and then, gone through the whole monotony. But when it's efficient, you start to think like how you want your mother or your sister or your family to be treated, assuming you like it.
And that's right, Dave. And the accuracy, and I have to point to our colleague, Dr. Christian Coachman, who turned me on to this 4 years ago with the term smile donator, where literally the future could be that a person looks at the smiles of, you name the person, or the brother, sister, mother, daughter, and we can 3D print and we can CAD CAM those exact natural tooth forms, whether it's a provisional or whether it's final restorations.
How about, let's take it a step further. Another patient of mine, I'm maxillofacial trained, so I treat a lot of cancer patients. I had one cancer patient with squamous cell carcinoma of the nasal cavity. So she had her nasal septum removed, then she had her nose removed, and then she had a recurrence, and now she has a big gaping hole in the middle of her nose. Thankfully, she had this right before COVID, so she's been wearing a mask, but for the longest time, her mask from the side is sort of flat. And when she came into the office, the same example. I scanned my assistant's nose, and my assistant was the nose donor, scanned my assistant's nose, and then I scanned my patient's face, and it was just a matter of behind the scenes just matching them up. And we made her a custom, before she had to go through surgery again, we made her a custom COVID mask with my assistant's nose incorporated in it. So now she's just able to go to the grocery store and have kids not cry or have people not stare at her, or just be able to kind of live a daily life just from the beauty of and the efficiency of digital.
That is such a beautiful story. Amazing. Amazing. Thank you for sharing that. That's amazing. So let's cast forward. Let's go 30, 40, 50 years, because we see what's happening now with computer science, computational, exponential medicine, the kind of advancements we're making so quickly today. We say that we double medical knowledge in 72 days in 2027, where it took 50 years back in the 50s. So things are growing fast. What do you see as, take me to a future, take me to a 40, 50 year from now future, Naif. Where do you think we might be?
It's a tough question for two reasons.
Yeah.
I think the technology will 100% advance. The one thing that we're limited by, or that we are held down by, is the biology, is the body. And that's why, despite advances in titanium, advances since the rabbit bones of Brandemark, we've still, the timeline, we've shortened it, but we still haven't been able to surpass human biology. So I really think that the advances that come along aren't going to be technological, but more so biological, with printable materials, with materials that are biocompatible and offer faster healing times. You know, in prosthetics right now, the shortage of I really think the future is additive technology and not subtractive. Mm-hmm. And what I mean by that is 3D printing versus milling. Mm-hmm. The reason is 3D printing is, you can make an infinite amount of objects in infinite structures, compared to milling, you have to carve it out of a block, right? Mm-hmm. To keep it simple. Now, the limitation right now, obviously, with most of these technologies is the materials. And we haven't been able to come out with materials that are promising enough to offer strength, stability, and kind of long-term vitality. Right. And I really think in 30 years, we'll be able to not only come with dental ceramics that are printable within your patient's same appointment, but thinking further, where I think skin prosthetics, limb prosthetics, surgical prosthetics that you can maybe, let's say we're doing a maxillary surgery and we have a cavity that we're trying to graft. That can be something that potentially we can scan. And then once we scan it, we can print a biological material that just gets placed into that location. It really kind of almost hurts my brain to think about all the possibilities.
Exactly.
I've heard of potential ultrasound scanning, where you can scan a tooth with ultrasound instead of, right now we're looking at the visible light spectrum. Now imagine being able to scan a tooth with ultrasound and not having to worry about bleeding, not having to worry about liquids, and just being able to literally just put the scanner on the tooth and it captures the information.
It's so exciting. It's such an interesting question. I was part of a group, and questions like that were asked of me, and it almost hurts the brain, but it's so exciting because it gives us context. Because let's bring it back to today, and let's ask ourselves the questions is, why do we have so many colleagues resistant to the newness, the new technologies? Dental schools still not embracing the digital workflow, and some are. What's the difference? Where is that coming from? And what are your thoughts on how do we move the industry in the direction of utilizing new technology to create the efficiencies and the effectiveness that we are seeing in our day-to-day practice?
That's great. The reason I say it's great is because it touches on something that I always lecture on. And I always say paralyze resistance with persistence. And you have to paralyze resistance that you get. If you have a vision, you have to paralyze that resistance with persistence. And I think the resistance that we get in the digital world in particular is that it makes people think that their knowledge will be obsolete. When in reality, the one thing that digital technology cannot replace is the human element. It cannot replace your knowledge and what you bring as a clinician and a human being to the table. So and this has happened in congruent industries. If we talk about the art world, When the digital medium started coming out, the oil painters and the people that were, the hand carvers, those were very resistant. But there's a reason that they're still here, because the human element can never be replaced.
Exactly.
And that applies not just for the clinicians, but it applies for the ceramists as well. And I truly feel that no matter what the advancement is, in ceramics, in printable ceramics, in machinable ceramics, in hybrid ceramics, and in composites, we'll never really be able to replace the true artistry of a technician. So, if you are one of those people that you find yourself resisting, I promise you, nothing changes with your knowledge and the value that you bring to the table as a clinician. The only thing that changes is your efficiency. So I would tell you that it would actually make you a better person. And I think that may be one of the fears that most people have, is that they realize that it's going to challenge them to become a better clinician.
Yes.
If you go to the chair side and see your prep blown up 150 times, just like that, by taking a quick scan and then looking over at it, that's a very humbling experience, as you know very, very well. And so it instantly makes you a better clinician.
Exactly right. And, by working with our technicians, it's this collaboration, and they make us better as we make them better with the reinforcement and the feedback we give each other. But I think the expression, you have to get comfortable with being uncomfortable, is applicable here, because that's what we're talking about. Let's get out of our comfort zone with a vision and a focus of how do we become the best versions of ourselves and make the people around us the better versions of themselves, as Matthew Kelly would say in his book, Rhythm of Life. And it's exciting. I have to close on this question to you, because I was at an innovation summit and they asked me, Naif, they said, do you think AI robot, if in 50 years was an unbelievable dentist, do you think that AI robot can replace us as dentists? And my answer was just what you said, the
100%.
human element. Is that right, Naif?
I could not agree more. As much as you can train AI, the beauty of AI is that it is based on algorithms and treatment decisions. But the beauty of the human element is that you can never replace the connection that you have with other human beings. And while AI might be able to make brilliant clinical decisions, in the short term, if we're talking about technology like the team that Dr. Stanley's come up with, of AI being able to look at radiographs and objectively being able to tell whether there is interproximal decay or not, that's really powerful AI. But that's not going to replace me, because I have to still be the one to do the restoration. But let's think 50, 100 years from now, if we have an AI that's able to do that restoration, well, that robot will never be able to make that same connection that I can with a patient. And what I mean by that is, if the patient, let's say, has, allergies, or if the patient has preferences to a certain type of restoration, or, being able to tailor the clinical experience to the patient's experience, that emotional connection will never be replaced.
That's right. That's right. The empathy and our ability to have this humanity cannot get replaced by artificial intelligence. And what we thought of is, instead of artificial intelligence, we said what it really is intelligent amplification. It amplifies what we can do. And I thought that was a good use of words.
That's a great use of words.
Yeah, I couldn't agree with you more. Naif, it is so fantastic to talk to someone like you who's doing it and keep inspiring this younger generation to really to do what you've done, and now to take it up to that next level as we look towards the future, because we know that we can transform people's lives with our profession, can't we?
We absolutely can. And, I speak for the young ones, even though you can't see that I'm balding. I do still speak for the young ones. We're only able to do what we do because of clinicians like you. You've blazed the path for people like us, and we just walk in your ashes.
It's very kind of you. Wonderful to talk to you. Amazing. And hopefully we'll be off our Zoom and we'll be face-to-face soon enough on the next Thrive Live.
Hey, can't wait.
All righty.
Thanks for having me, guys.
Fantastic talking with you. Take care, Dr. Sinada. Amazing. And keep doing the great work you're doing.
Will do.
Okay.